As the coronavirus crisis stretches on,
I have seen anxiety, depression, angst, frustration.
the long-term health impacts of surviving a global pandemic are becoming clearer. More and more people in the Bay Area are struggling to cope with the effects the pandemic is having on us physically and mentally as well.
I could not function. I was not able to take care of myself.
We're living in what feels like an endless string of days, all the same, filled with fear, worry, and uncertainty.
I worry about how do we make sure we are taking care of our most vulnerable communities? How do we not forget them?
How do we care for our bodies and our minds?
We are in an age where we have to parent ourselves in a loving way.
At a time when we need it most.
Don't suffer in silence.
This is a KTVU special report, Coping Through COVID. Hello, I'm Gassia Mikaelian. Welcome to Coping Through COVID. In this next half hour, we'll take a closer look at how the COVID-19 pandemic is affecting our physical and mental health. Even if you haven't lost a loved one to COVID-19, fallen ill yourself, or lost your job, it is almost certain you are feeling stressed. Though I'm grateful to have stayed healthy and employed during this time, like many of you, I have at times felt deep loss and sadness. I hope you find our time together helpful. Certainly everyone reacts differently to stress, but the data point to a nation on edge. A recent study by the CDC found 40% of people are suffering from at least one mental or behavioral issue, such as depression, anxiety, post-traumatic stress, or substance abuse. That number is 3 to 4 times higher than it was just 1 year ago. 1 out of every 10 people said they'd seriously considered suicide in the last 30 days. Seniors are among the groups of people being hit especially hard by the stress and anxiety of the pandemic. KTVU's Rob Roth spoke with a 90-year-old San Francisco woman about the effects of being isolated for so long.
For the elderly, many of them living in the bubble of nursing homes and senior care facilities, COVID-19 isn't just a threat to their physical health, but also their mental condition.
The worst part is not being able to see my family and my friends.
At 90 years old, computer-savvy Isabel Collieri says despite the pandemic, she's doing just fine in her assisted living community in San Francisco.
If this had happened before Zoom and all that kind of stuff, it would have been a nightmare.
She can even joke about the situation.
I'm now so senile that I don't realize how miserable I am.
You're not senile.
While Collieri may be coping as the holidays edge closer, psychologists worry many seniors may be headed toward an emotional tailspin.
We have been talking about a mental health tsunami because of the pandemic and everything else that's going on.
That tsunami, cautions University of Santa Clara psychology professor Dr. Thomas Plant, could bring with it what he calls the big three: depression, anxiety, and substance abuse.
Suicidality, domestic violence, child abuse, and so forth is likely to be a factor for so many. And certainly the elders who are vulnerable to loneliness and so forth as it is, just makes it that much worse.
In a poll recently released by the Kaiser Family Foundation, 46% of those aged 65 and over surveyed in July said stress over COVID was having a negative effect on their mental health. In May, only about 30% felt that way.
An awful lot of people feel rather lonely when they are sequestered into some of these facilities.
Mental health professionals are urging family members to regularly check in with any elderly relatives, and any seniors starting to feel down should also reach out to family members. And we have one other piece of advice.
Keep busy. If it's all online or on whatever, being busy is medicine.
Rob Roth, KTVU, Fox 2 News.
The COVID-19 pandemic is also disproportionately affecting people in minority communities. The Bay Area's 3 largest counties report hundreds of COVID-19 cases in predominantly Latinx neighborhoods. Latinx residents make up about 21% of the population, but account for more than 35% of all cases. And data show about half don't have health insurance.
People in the Latinx community are oftentimes working in those conditions where access to PPE and that safety is a struggle. And so then there again, they are overexposed or more vulnerable to exposure.
The CDC also says the rate of deaths from COVID-19 among Black people is nearly 5 times higher than for whites. Many people report feeling mentally or physically exhausted, even when things are about as good as they can be. I turned to the San Francisco Department of Public Health to learn why.
We are on a chronic stress ride for now many, many months. Because it's in the collective and we hear so much about people being sick, people losing jobs, because our day-to-day lives are changed, we're wearing masks, we're going to stores and standing on lines. Some of our stores and places that we frequent are closed. Our whole life has changed.
What have you found and what have you learned can be physically directly related to the stress we're feeling?
Well, sleeplessness, headache, extra tension in the neck and shoulders, backache, general feeling of malaise or body ache. All these things can indicate something's not quite right, because the body is keeping the score and the body is talking to us all the time.
From sleepless nights to sudden hair loss to feeling irritable even when nothing is immediately wrong, the human body shows us when it's under stress, and long-term stress can compromise the immune system with devastating effects.
Tell me about that connection between how stress we're feeling can affect us in a very physical way.
Yes, well, it's very well known that stress and trauma, this is why we are working on it in the Department of Public Health, because it's a public health issue, stress and trauma. I mean, we see heart disease, lung disease, mental illness, depression, even cancer. Long-term aggravated stress and trauma over a period of time can so debilitate the body.
Do you expect the COVID-19 pandemic to have a long-term health effect, even on people who weren't physically ill with COVID-19?
Unfortunately, yes. I mean, we're actually hearing that. We're hearing that from researchers already. I think that it's not going to be a one and done, oh, it's over, we have a vaccine, that there is a lingering effect that we will still have to attend to because our systems have been traumatized.
Johnson says we're likely all dealing with increased levels of the hormones cortisol and adrenaline. They spike when we're faced with a sudden stressor.
It gears us up. It tells us that there's something that we need to respond to. Tiger's coming into the room. Okay, I'm going to need to run. So the lunch that I just ate, we're going to stop digesting this food because that's not what's necessary. I need that energy to go to my legs so that I can run. But if there's no tiger in the room and we still have that level of energy running through our system, it can be very depleting. And over a long period of time, it can also harm our systems.
Thankfully, Johnson says the solution lies within the body as well.
It's what we all have, and it's our breath. It's coming to the breath. It's called stop. So you stop, you take a breath, you observe, and then you proceed mindfully. You give yourself a moment. You can do that in between patients, clients, mail carrier, in between houses, going up someone's stairs. It activates the calming response in the body.
Johnson says these days calm has to be the starting point from which we accept and process the physical, mental, emotional, financial, and societal loss brought on by the pandemic.
We can be either in resistance or acceptance. So a lot of time we're in resistance. I don't like this. I don't like that. Why is this? Nah. And so that generates an energy that is spiraling, and actually, although it's spiraling, it's depleting because it's not replenishing us with the things that we need to build resilience and inner calm.
She also says those who are able to focus on any positives that come from the pandemic, such as more time with children, a deeper relationship with a parent, or even appreciation for food in the fridge or hot water coming from the tap, will be in a better position afterward.
This is not a time to be hard on yourself, to try to make grand leaps and goals. The grand leap is to get through the pandemic in good health. That's the grand goal. You can improve relationships, you can see new possibilities, you can increase your personal strength, you can increase your spirituality and have spiritual growth, and you can just have a greater appreciation for life. So we can come out on the upside, post-traumatic growth. It's how will we tell the story? Will we go doom and gloom, or we say, in spite of this, and every great move of suffering in humanity, there have been people who will tell you, yes, that happened, but I'm still here. And that's the victory.
Any parent will tell you the pandemic has turned life upside down at home. KTVU's Maureen Naylor reports on the challenges families are facing.
Parenting during a pandemic can be summed up with one word, according to this East Bay mother: juggling.
Now it's a constant all-day job. Even when I get home, it never ends.
While trips to Disneyland and school drop-offs have stopped, Tiffany Lawless El-Salam and her husband continue working full-time outside the home, while their 10-year-old daughter does online school, online music class, and online Girl Scouts.
Our challenge is making sure she's able to succeed and excel, and as well as not falling and dropping any ball at work. So that's been challenging.
Research from the American Psychological Association showed parents with children at home under the age of 18 were noticeably more stressed than non-parents early on in the pandemic. A University of Oregon survey found parents of young children are particularly stressed, with another survey finding 63% of parents reporting feeling they had lost emotional support during the pandemic.
The biggest thing I'm seeing is anxiety, stress, and depression.
Heidi Emberling coaches up to 500 families a year through the social services agency Parents Place in Palo Alto at the Center for Children and Youth.
I think the biggest stressor is, when will this pandemic end?
From job loss to illness, parents are juggling a lot now 8 months into the pandemic. Emberling says she's seeing more behavioral challenges with younger children, along with depression and anxiety in teenagers, and sleeplessness for both children and parents.
And I think trying to manage the demands of work with everyday parenting responsibilities and then adding your children's learning on top of that is a level of stress that I haven't seen before.
To cope, she suggests parents go easy on themselves and focus on short-term goals, advising families get regular exercise, time outside, and find new ways to connect with family and friends. As for Tiffany and her family, they are adapting.
You know, I do have my days of being anxious and feeling worn out. But, I think we've gotten to the point of being able to, cope through this.
While they're missing their friends and unsure of when in-person learning will resume, each family member is also finding new sources of joy. Tiffany has joined a roller skating group. Her husband has taken up golf, and her daughter is taking drumming and art classes.
I think she's learning from this experience and actually is making her a stronger person.
And Tiffany admits she's a stronger mom now, too. Maureen Naylor, KTVU, Fox 2 News.
The children in your life are likely stressed as well and showing it in ways you may not recognize.
Anxiety and depression can be very silent. And so parents could be living with a child or an adolescent who's struggling and not know about it. And they shouldn't feel guilty about the fact that they didn't recognize it either, because it's actually quite common that you have somebody in your family who's going through a lot of stress and you're not aware of it.
Psychiatrists say it's normal for younger children to become more clingy, report more headaches, or show changes in temperament and behavior. They add consistency is key and reassuring to children and adults. Coming up, for some, a cocktail at the end of a long day may have turned into 3 or 4 or more. How some people are turning to alcohol and food to cope, and when doctors say you should worry. Plus,
I need structure more so than the average person, I'd say. I'm ADHD. And so living with, waking up, doing a certain thing, showering, going to work is like, it makes it so that I'm able to do things like housework. And when I no longer have structure or the ability to shape my life around something else, I can't do anything else. I find it really hard to function and do daily behaviors. So dishes piling up, laundry piling up was just a very, very big thing.
It only works while it's working, so it works in the minutes that you're eating the food, but then it's like that game whack-a-mole at the fair, right? You finish your food and that little mole is right back up again.
Behaviors many people used to joke about are becoming serious problems in the pandemic. Since mid-March, alcohol sales have been through the roof. They jumped 24% during shelter in place. The federal government estimates some 15 million people already suffered from alcohol use disorders, and that number has only grown during the pandemic. Even people who weren't in the habit of reaching for alcohol or food in times of anxiety or boredom are doing so now. 8 months into the pandemic, psychologist Brenda Schaefer, who specializes in addiction, says millions of people are suffering.
We have abuse, we have addiction, we have relapse, and we have the ordinary people who have these additional stressors in their life right now. And coping with alcohol is one way to deal with stress. We can slip into an addiction without even realizing it. And that's true of many addictions. It does what it does. For you to say, well, I can stop the effect is like telling the sun to stop melting snow. It just does what it does.
She says it's no surprise people are increasingly reaching for alcohol to help deal with feelings of anxiety or despair that have become common during the pandemic. Food, too, has become a coping tool for many.
How does loneliness and isolation factor specifically into disordered eating?
We're sort of limited. And so if you think about it, the fridge, it's right there. It's accessible. Food is delicious, and it is the one thing that we have control over. So I'm going to lean a little more towards self-soothing with food. But of course, communicating through a behavior such as food can look like self-soothing, overeating, undereating, and everything in between. Emotional eating is a very normal part of a really peaceful relationship to food. There's all kinds of factors that come into play with what shows up in our food. So I definitely don't want to demonize emotional eating. I think that it just becomes a problem when it gets more habitual.
When it comes to breaking that habit, both experts say there is no amount of food or alcohol that can solve COVID-19 anxiety, depression, or boredom.
It only works while it's working, so it works in the minutes that you're eating the food, but then it's like that game whack-a-mole at the fair, right? You finish your food and that little mole is right back up again. So there's no diminishment in your original desire or whatever your craving was.
They say take a pause and think about how you're feeling.
Well, we do know that alcohol is related to people feeling irrelevant, people feeling lonely, sometimes just plain bored, that sense of hopelessness and loss of control. No one can control this. And that powerlessness is another drive to go for that extra drink or that extra glass of wine.
The experts say if you're habitually eating or drinking out of anxiety or boredom, the next time a craving hits, take a pause. Assess your emotions and take appropriate action, such as texting a friend, taking a quick lap around the block, or reminding yourself of what you're thankful for. Things that can help you be more connected, active, and upbeat, instead of just making yourself feel better in the moment. Still ahead, navigating a holiday season that'll be anything but traditional. And
in the beginning, it kind of just felt like, I was having, and I'm not sure if some people are familiar, but like depression episodes where there would be days like I really felt like there was just this heavy weight and I couldn't get up out of bed, and I would just stay there for like 15 hours in the day, wouldn't shower, I wouldn't want to get up or do anything, or I felt like it was too much energy to send a text message back to a friend. So those are depression episodes that I go through when I kind of cut off contact or change kind of a normal schedule in my life. And those are things that I try to be aware of now. But yeah, so that was really hard.
Americans are seeking more psychiatric help than before. The use of antidepressants and anti-anxiety medications had been on the decline for the past 5 years, but that number jumped by 1/3 starting in mid-March.
We do not have to be at our lowest to access mental health support. If anything, the sooner we can access it, the more likelihood we can start to get the benefit from any of the treatments.
Dr. Iglesias says she is hopeful the growing awareness about the importance of mental health will be a lasting positive effect of the COVID-19 pandemic. This Thanksgiving, thousands of families will be without their loved ones due to health restrictions. Many fear the holidays will only amplify the loss and grief of the pandemic. While the holidays are typically a time of joy, this year mental health experts say they'll likely magnify the trauma brought on by the COVID-19 pandemic.
When someone loses a person that they love in an unexpected way, and for many people, it feels like an unnecessary way. This didn't have to happen. If we'd had better guidance or better help in managing this, that we wouldn't have lost grandmother or our aunt or even our child. And that can bring up a lot of anger and resentment, hatred. That kind of thought is like drinking poison and hoping someone else will die. It never works. Forgiveness is key here. Forgiveness of ourselves for not knowing what we didn't know. Forgiveness of those who were not able to help us when we really needed help. And often that feeling of helplessness. What more could I have done? There must have been something else I could have done. And there isn't, most likely. You did the best you knew how.
Dr. Barbara Cochran, a psychotherapist in the South Bay, says holidays are full of important rituals that'll surely be far more somber this year.
Anything that's not resolved, anything that's unfinished, any ongoing trauma or pathology, it's all of a sudden like you turn a bright light on it and you say, oh, yeah, there it is again. It's still not done. I still don't know what to do with it. And it's called a second wounding. I had the first wounding with whatever the problem was initially. The second wounding is going back and visiting again.
If we find ourselves in that position of looking back at 2020 and looking forward to 2021, what's a better way to do that than just sit and stew in misery?
Well, I like what you said there. Sitting and stewing in misery is never a good idea. It never gets us anywhere. However, the way that life goes for us, external factors are not things we can control, ever. But we can absolutely and unequivocally control how we respond to them. So when we look back on 2020 and all the horror of that, there were some powerful, powerful lessons there if we choose to listen. And you've always got to remember that fear plays a big part in our lives. And it can either be a teacher, which will help us find new ways and innovate and find ways to love and heal, or a master and keep us in prison psychologically, emotionally, and spiritually.
She says do whatever is possible to foster joy and generosity during the holidays and make sure to reassure children that Santa is coming.
Not to sound cliche, but it really is about the meaning of this time. It's about giving, and Santa will always come. Santa is the spirit of love and sharing with others. And one of the ways to make Santa come is kind of piggybacking on what we talked about before, is go out and do something amazing and feel what it's like to give to someone else. Because when you do, you will receive an immense number of gifts in return.
She also says if you feel like turning off the holidays, go right ahead.
Right now, especially, self-care is everything.
And believe it or not, a lot of people struggle with what is self-care? What really makes me feel good? Because they're often so focused on being busy or being externally motivated that they don't think about really what makes me feel good. So if Netflix and a reasonable amount of alcohol make you feel better, go for it. Have a wonderful time. People tend to fall into this fatalistic idea that this is the last holiday I'll ever have. And if it isn't just exactly Currier and Ives, I can't possibly be happy going into the new year. And nothing could be further from the truth. You can find innovative ways to connect with people that you love, and you can find new fun traditions to have that you've never thought of before. And that's the beauty of change. That's the beauty of negative things. Amazing, wonderful, loving things can come from them if we allow them to.
We have a number of resources to share if you or someone you love need help. There are free groups and hotlines to address any number of mental health concerns. In addition to these national hotlines, we've also posted the numbers for county resources in your area. The information is all on our website. Visit KTVU.com or download the KTVU News app to see the information we've shared today. Thank you for joining us for a KTVU special report, Coping with COVID. I'm Gassia Mikaelian. We'll see you on the air and online.